I don't know the area you want to touch generally as an introductory part before I start directing as a moderator based on the questions I have here. I want us to attend to. You can use the mic, sir. God bless you. Once again, let's celebrate Dr. Sunny Omozuwa, MDCO, Standard Kings Medical Center. Is that the best you can clap? Oh, because you just saw him here like that. Until when you're in a place that you can't even reach. That man that came to our church that day, he has practiced for a long years now, as far as I'm concerned. He can do more of that about his profile. It's also allowed. God bless you, sir. Thank you for coming.
Good morning, everybody. Yes, I think let me first of all, thank my brother, my friend, the general overseer of this great parish.
The senior pastor.
The senior pastor, okay. My in-laws, my friend has actually introduced. I am Dr. Sunday Omozuwa, the founder and the owner of Standard Kings Care Specialist Hospital and Maternity Limited here in Upper Sakumba. I hope many people know that hospital. Yes, it's about one of the finest hospitals around here.
That's true. Let's celebrate that. That's true. It's really Standard Kings Care, so the standard is touched now.
Okay. Also to that, part of the thing I do, I am also an associate professor. I'm a consultant obstetrician and gynecology. Presently, I'm the deputy provost of the College of Medical Sciences, Edo State University.
Can you clap for that? Thank you for coming.
Yes, so, yes. Well, I didn't come with a special topic.
Yes, we have. We don't have a special topic.
Yes.
Areas that I know as a medical personnel that you can be of help to us. I wouldn't want to use the word area pressing.
Yes.
These are the areas I want to discuss on.
Yes.
For instance, most predominantly prostate cancer. Okay. A lot of people have heard about it, but they may not understand what it means and the way it operates. Yes. Because one of the essence of this head talk, it also lets up to enlighten our people. Because we're told that oldest stage at 30, but most of them don't know. By the time you are 40, there are things you're supposed not to do if you want to put your body in check. And there are things you have also not experienced. I remember when we were growing up, far you, some men can bear me witness. You want to belong, then you try to force beard out by rubbing spirits or whatever, Abi, so that they also know that you two have grown. You see that you should be aware. Are you getting my point? Of the things that as a man that intend to come your way. Did you get my point, George? As a man. Now, ignorance of the law, they say, is not an excuse. Now, what is prostate cancer?
Well, there are the people that are actually, who have authority to speak to the issue of prostate cancer are those special doctors who are called urologists.
Okay.
Yes, they specialize in male reproductive part, and they are the ones that deal with that. But be that as it may, I can still throw more light on prostate cancer. Let me tell you, prostate cancer is one of the deadliest diseases that is confronting men presently. It's just likened to CA cervix, cancer of the cervix.
I'm coming to that.
Yes, and more than 500,000 people are diagnosed with prostate cancers every year. And it also, kills a lot of people, especially if it is not diagnosed on time and you didn't present on time for treatment. It's a cancer or it's a tumor or a growth that affects the prostate glands. Prostate gland is part of the male reproductive organ. During spermatogenesis and during sexual intercourse, the prostate has a role to play by, secreting certain chemicals or substance to add to the sperm to make the sperm more viable to do what he wants to do during fertilization. So the prostate gland is actually situated, in the pelvic region. The prostate gland, the pipe that carries the urine from the bladder to the outside actually passes in between the prostate gland. It's just situated at the neck of the bladder. So the prostate cancer is a cancer that affects that particular areas of the body, the prostate gland. Like I said before, you see, when you talk of cancer, it does not just start one day. Do you understand?
Okay.
There is a pathway. It takes a long time. There is even what they call the pre-cancer stage of it. So at that stage, if it is detected at that stage, it can be cured, it can be treated, and it can be completely eliminated. But the problem is that at the time it is advanced, in the advanced stage, before you now present, it becomes difficult to treat. And that is why it kills a lot of people. Now, what is the message here? The message here is that early detection is the key to the prevention and treatment and eradication of prostate cancer. In fact, it applies to all cancers of the body, even when we come to CA service. So, when you are already 40 years and above, you are, as a man, prostate gland is found only in men. If you are already 40 years and above, you are at risk of developing prostate cancer. And then, if your parents, if your father suffer prostate cancer, then your risk of developing prostate cancer doubles. Then again, there are also what we call risk factor, or some of the things we are also exposed to in the society that can also, make us to develop prostate cancer. There are some we call modifiable and non-modifiable risk factor. So some of this one is age, which I have just mentioned. At the time you are 40 years and above, as a male child or a man, you are at risk of developing, prostate cancer. You see, the issue of age is the one you cannot modify. You can't change it. You are 40, you are 40.
Even if I change it on paper.
But you just be deceiving yourself. So, once you are already 40, you are already at risk. So, it now, present to you that you have to go for screening. In advanced country again, you also see the kind of situation we also live, especially in the black world. In advanced world, the government, there is a system in place that track you. The day you clock 40, when you are supposed to start screening for that prostate cancer, it rings either in your phone or whatever. The health authority send message to you.
And you are already 40.
You are already
reminding
there.
you of your age.
Yeah, to start doing a prostate screen. Okay. And you go there and you do it. And, it goes on and on and like that every year, depending on the age you are, 6 months every year and thereabout.
So what are the things that can cause it?
Yes. Some of the things that, okay, let me just quickly look at the risk factors. So age is one. When your parents or your father has a prostate cancer, you are also at risk. Then when you also smoking. When you
smoking?
Also, yes. When you are.
What type of smoke? Cigar, bibo, shisha,
any type of
any smoking
that now results in producing okay. So you can also predispose somebody to having prostate cancer. Then again, if you also you are exposed to some irritants, what I mean, some environmental hazards
Okay.
can also cause irradiations. You understand?
Does it also apply to the nature of one's job?
Yes, it also applies to the nature of job you do. If you work in a asbestos company, if you work in a company where a lot of fumes are produced, if you work in a radiation, maybe in an X-ray room and all that.
When you handle vibrating engine, does it affect?
When you also, yes, it does. It does. And that is why before you enter some of those jobs, they do what they call pre-employment screening and all that to detect your health status.
Let's celebrate him. Now quickly, because of time, we are moving to cervical cancer. What is cervical cancer?
It's like the greatest killer of women. The greatest killer of women. In fact, every year, almost close to 1 million cervical cancers are diagnosed every year. Yes. And it also killed more than 500,000 women every year. Especially in this part of the world, when we don't take things serious. We present when the cancer is already in advanced stage. And let me tell you, when it is already in advanced stage, there's nothing we can do about it. We can only do palliative measure and
not to even removing the womb for
even when you remove the womb at the advanced stage, what of the one that have already entered the body, because the cancers also spread into some other parts of the body. So that is why we also say that early detection is also the key. Now, what are those things that causes or the risks that predispose a woman to developing cervical cancer?
Yeah.
Like I said before, any woman of reproductive age from the age of 30 and above, from the age of 30, you are already at risk of developing cervical cancer. Even from the early stage, even as low as 20, even 18, especially when you start to engage sexual intercourse at a very tender age, you are already at risk of developing cervical cancer, because the cause of cervical cancer is sexually related.
Okay.
There is a virus that is responsible now, which a lot of study has been done on. The human papilloma virus is the cause of cervical cancer in women. And how do you acquire human papilloma virus? It is through sexual intercourse. And that is why we are saying that, most of the campaign in preventing cervical cancer is actually on eradication of what?
Indiscriminate sex.
Yes.
Okay.
The eradication of the human papilloma virus and education on early exposure to sexual intercourse.
Oh, sir, if I may come in, I'd like you to answer it this way. Can a married woman be exposed to cervical cancer? And if she does, what's responsible? If she got it from the machine, you said part of it is sexual related or whatever.
If every woman who start to have sexual intercourse at a very tender age at risk of developing cervical cancer.
Why the tender age? Is it the duration of the usage? Sorry, sir.
Yes, because that neck of the womb that I talk about, the cervix, there are certain tissues, there are certain glands there. When they are exposed to early sex, and during that sexual intercourse, the person you have sexual intercourse has the human papilloma virus, and that virus is deposited on the cervix. Then it makes the cervix to undergo changes, which now set a stage for that woman to develop cervical cancer later in life. Now, like the question is said, that is why multiple sexual partner for women that are already married become a risk factor.
That is when a man is cheating on his wife.
Multiple
he predisposes his wife to cervical cancer.
It's both ways. It's both ways.
When a woman is also cheating.
Yes, when a woman is cheating or having multiple sexual partner.
A married woman.
She's also at risk of acquiring that human papilloma virus. Again, when a man is also engaging on multiple sex, he is also at risk of carrying that human papilloma virus from other women
to his wife.
It's just like HIV.
No be enjoyment too.
It's just like HIV. So, like I said before, early exposure to sex is a cause of cervical cancer. Those who also have multiple sexual partners is also a risk factor to developing cervical cancer. If both men have multiple husbands or multiple relationships, men also have multiple wives. Also can.
So how do we checkmate it?
Yes, in controlling cervical cancer, like I said before, early detection is the key. And what do? Are
you suggesting that women should go for cervical
cancer screening? Yes.
At what age are they supposed? Yes. And how regular should it be?
Yes. Cervical cancer screening starts as early as 20 years. Do you understand? As early as 20 years. Because we need to catch them early.
Sir, for those, suppose as early as 20, I have not had sex, I don't know any man. Am I supposed to also go for the screening?
Yes, you may not go for screening. For those who are between the age of 9 to 18 years, there is a vaccine we give them. And it's available now. And I'm very happy that you brought this topic.
Sir, Nigerians, we don't trust ourselves. How reliable and authentic is that vaccine?
Yes, there is a vaccine for the youngest who are not exposed to sex yet. That vaccine is good for those who have not exposed to sex.
As it but for those that we can take
who must have also mistakenly been exposed to sex, you can still go and take it. It's 50-50. It may work for you, it may not work for you. But for those who have not had sex, that is why we want to catch them early, between the age of 9. The vaccine is available between the age of 9 and 12. Do you understand? That vaccine is available now. I think it's in the Ministry of Health. So you can go there, all those young girls between the age of 9 and 12 can go there and have the vaccine. It protects against the human papilloma virus. So for those who are already exposed to sex, those are the ones that are, that can benefit from screening. Screening will now help us to detect whether you're already having the virus or you're already having the early stage of the cancer of the cervix.
Let's celebrate doctor for that. All right, sir, quickly because of time. This day we have even young girls in their 20s do suffer from fibroid. Why?
Yes.
What's the cause of fibroid?
The cause of fibroid. Fibroid is a tumor that develops in the womb. The growth is just a growth. And most of the time, these fibroids, they are not.
If you have your questions, start getting ready.
These fibroids, they are not cancerous, but they are tumor that can grow in the womb, and it can assume a very, very big size, gigantic size, depending on the duration, depending on how you keep it from, doing surgery for it. So those people who are exposed, or the causes of fibroids, are those who have, excess estrogens being exposed to their uterus, or those who have stayed a long while. You are married or you are not married, and your age has gotten to the age of about 30, 35, and you have not carried pregnancy for once. So those people are at increased risk of developing uterine.
Increased risk. Now, there are people in their 20s.
Yes.
Why?
Yes.
Why were they diagnosed?
Also, you see, in gynecological consultation, there is hardly any day I'm consulting that you don't see 2 or 3 cases of fibroid. Fibroid has been linked to some genetic inheritance. So some of the chromosomes, the alteration in some of the chromosomes in our system, and that is why most of the time that chromosome alteration is common in the blacks. So the black man has a higher propensity, or black women has a higher propensity to developing uterine fibroid. That is why young girls, who already have that chromosomal abnormality and they are exposed to high estrogen, their uterus is exposed to high estrogen, before you know it, even before they get to the age of 20, they already develop uterine fibroid. Do you understand? So it does not mean that you have to be advanced, because we have seen uterine fibroid in 15 years old. We have seen uterine fibroid in a 20-year-old girl. Very big. We have to remove it.
Sir, outside surgical operation, are there other remedy to fibroid? Yes,
there are no surgical remedy to fibroid. There are drugs. If it's not very big, there are drugs you can take to shrink the fibroid. There are also some people who are also advanced in age who cannot withstand surgery. We also give them the benefit of also using medical treatment, using drug for fibroid. Again, there is also machines now that are available to mend fibroid. There are ultrasound guided, machine using high frequency to mend fibroid. It's available now, right. Especially for those who want to do IVF. I will discover that if we open up the womb and it will affect the integrity of the womb and all that. And the fibroid is not too big, we can actually send them for that machine, to melt it, so that the womb can be smooth, the womb can be well prepared to receive a baby.
Let's celebrate him. So we are here to learn. There are women, some of them have had like 4 children, and they may feel like they have all males or all females, or maybe in most cases both male and female, and they just feel like, let me still add one. Now, at what age is it advisable for women to stop childbearing?
Yes.
Give birth on time, avoid giving birth in old age.
Yes. When you are starting a family, my people, the best time to have children is between the age of 20 and 35. So
there's a question I want to ask now. It may shake the table on your side, but I don't mean to offend you. You are a surgeon. You are a surgeon. A surgeon. Now, some people, or rather, firstly, let me ask, what are the reasons for cesarean surgery?
Cesarean section.
Are we getting the signal clear, media?
Yes.
All right.
Cesarean section is a life-saving technique or a life-saving procedure that we have to.
Please, the question can begin to come in case we do.
Yes, that we give to a pregnant woman who are in labor, who have indication or who have a reason to go through cesarean section primarily to save the life of the mother and the baby.
But people believe
cesarean section is work. If you deliver normally, I'm happy.
Even you as a doctor,
yeah,
you don't mean that. What are the things that predisposes or exposes a woman to that level, so that they can know how to?
Let me tell you, another way to also prevent cesarean section in the hospital is during delivery is for you to register in a well, how do I call it, in a good hospital.
Okay.
Good
so that they will monitor it.
Yeah,
if there will be complications.
Good hospital does not mean my own.
Okay.
A hospital that is
standard,
that is good
with equipment,
where women attend regular antenatal. It can even be organized by a retired or an experienced matron or a midwife who know what he's doing. The only problem is that if the person don't know what he's doing and he just attend to you, because if you attend antenatal clinic right from the day you booked, like in my hospital, when you book, the first time you see me, I will assess you and I will grade you and I will look at the risk factor that is in that pregnancy. Start telling you, and I will all the dangers that is involved. Like somebody who has who is undergoing a regular antenatal clinic, we discover the baby is big. Maybe that is your first time of having pregnancy, and we assess you at 36 weeks. We discover that your waist is small. Baby is big, your waist is small. Maybe you are a short person. We are very
Yes, sir. That's the area I was coming to ask. Is it superstitious or is it true that most likely people who are short are bound to have complications in delivery?
Yes.
Is it superstitious?
Yes.
It's actually
Your,
medically confirmed.
Your height.
Hey, one house.
Your height. A woman's height. A woman's height also determines the pelvic size.
Okay.
Yes, if somebody is short, if a woman is short, especially the shoe size, we normally use the shoe size.
Everybody stretch your leg now.
So if your shoe size,
it's time to check your shoe size.
If your shoe size is less than 4,
yeah,
you are likely to have a small pelvis. That's what we call contracted pelvis. We assess all these things during antenatal clinic. Then we compare with the fetal weight, especially the presenting part, whether the buttocks or the head. So inadequate pelvis is another reason why a woman.
Let's celebrate Dr. Omozuwa. Did you just learn something? Everything is not devil. Knowledge is key. Please always seek medical advice. Don't assume anything. And like I've always told you, if your husband can make you pregnant, let it take you to a good medical facilities. Go for antenatal checkup. Now when you are going, don't also avoid the class. So women go there late. Yeah. When the class section over, they just go there and collect their, is it folic acid you call it? They carry belle go, tell the husband, is a checkup. Some of them just are supposed to collect transport fare. Yes. Yeah, clinic there now. Yes, the 2,000 me, the 3,000 me. They buy a ground, the way drink Mirinda. Go there late. They don't attend the class. Collect folic acid they will not even use. And at the end of the day, there is complication. And the man will say, "I thought you were going for antenatal care. Oh, guy, your wife no enter class. She only went." Let's celebrate Doctor once again. So we have, okay. You want to say something?
Okay, just say something. You see, like some of the issues that we also face as Christians, especially when we are talking to pregnant women. I'm happy that my brother is the enlightened one. You know,
I thought you would celebrate me as the enlightened one, and you are looking like that. Thank you for that.
Some women, we will tell them you have placenta previa. That is, the placenta is coming before the baby, and you are going to have cesarean section. They run away. They go to some church. The church will start telling them that you will deliver like the Hebrew women.
Oh,
how are you going to do that? How are you going to do that? It's not possible.
Because I have cases that they say the baby use the umbilical cord to round the neck around the neck.
To wrap the neck. So let me tell you what I tell my pregnant women, because I'm also a Christian. So if you are a Christian, I'm also a Christian. Then I will tell you that, look, those people that deliver, who are those that deliver that like the Hebrew women? You know what those Egyptian women were doing in the Hebrew. You understand? So those that deliver like the Hebrew women are those that deliver
and have their children.
They have their baby and they are alive, irrespective of where the pregnancy, where the baby come out from. Do you understand? If you
whether vaginal delivery
if God said you are going to have a cesarean section, so shall it be. It's not. It is those days we use.
So it's not a death sentence.
It's not a death sentence. It's those. In fact, I can close my eyes and do cesarean section at my age, with my experience, with what the level I've got to in the profession. I can close my eyes and do cesarean section.
Hey, but you are not the one paying.
Whether anesthetist is
the man is the one paying. Maybe that's the area they have seen it from.
Yes.
That the beasts that are involved.
No, it's the level of expertise. It's the level of experience. It's not at those days when we have to be afraid to want to do operation and all that.
Okay, what you are saying, you are trying to tell us the safety.
Yeah, the safety.
That cesarean section is not a death sentence. That somebody is going in for it doesn't mean the person will not come out. Oh, you are trying to say that by experience that there is a guarantee by the grace of God that you go in and come out alive.
Very successful.
All right, let's thank God for that. But we don't pray that you have it.
Yeah.
But should the case you have it, it's not a death sentence. It's not as if you have done the abominable. It's not as if God is no longer God. So that when you now come, you are not thanking God. Some people did it, God forbid, they didn't survive. Some of that did the baby, they didn't survive. Another also based on complications owing to delay in response. Like what he said, the man that is in charge is telling you that this thing will only go through this. Especially if it is also a Christian. Because there are also hospitals where they believe in prayers. He came there and said, let's pray. And I believe they also pray before they undergo all these things.
If I reach hospital every day, I pray.
Yeah.
If I want to do operation, I pray.
Yeah, because that is also risk. You don't know they still follow come for house. They call bafuka for your hand now. Doctors are also careful because it is not a palatable experience for a doctor for somebody to die in the ward. They don't enjoy it. They like when a patient is leaving, the parents get thank you doctor. Whatever they pay, they are happy about it.
Anytime I lose, I am a woman advocate, and that is why I have to study obstetrics and gynecology.
Okay.
Anytime a woman dies, it's a serious tragedy. Not just only for the children, the family, even for the nation.
Yes.
Maternal mortality is a national tragedy,
yes.
Especially when it comes to a country like ours.
Yes, on the developing nations,
where the health
facilities
system has failed us, where the government has failed us.
Did you hear that from a doctor now that the health system has failed us?
Yes,
God will help us.
The health system has failed us.
And our government should do something about that. Government, please, do something about that.
Because in advanced world, no woman is supposed to die.
Yes, I've heard about that.
While doing the process of reproduction.
Yes, and they also leave ahead on time to checkmate that.
You are just trying to do what God has destined you to do. Why should you die? Why should
it's
you die?
It's a good question.
So it's a neglect of our people.
Yeah, negligence.
It's a neglect of the society.
Yes.
It's the way we take women. Because even before now, because there are a lot of advocacy going on around for the women. Even before now, women are usually regarded as nothing. You force them into early marriage. You force them to go and start having children when they are not supposed to have children. They develop VVF. They develop obstetrical labor. They died in the process. This is not supposed to be in a normal society, and that is why we are saying that women should wake up. Women should be empowered. Women should be given the opportunity to advocate for themselves. We need more women in government. We need more women in the parliament. We need more women to stand up for some of all this social neglect, so some of all this the societies is giving to them. Before, it is in some families, you don't send a woman, a girl child to school.
Yes.
You understand? Even while in school, there are discrimination against the girl child. Even in some countries today, in some culture, do you know that there are certain work a woman cannot do? Even when a woman do the same work with a man, they are paid less.
Yes, I think in football, Nigeria had that.
So these are
where the Super Falcon were also crying for the same pay with the Super Eagle because they are playing the same football.
Are they not playing the same football?
Let's celebrate. God will help us. We won't get to that stage.
Yes.
Let's celebrate Dr. Sonny Omozuwa, MDCO, Standard King's Care Medical Center. Is that the best you can clap? Thank you, sir, for coming. We do hope that next time we'll call. We'll have your presence. I know you are a very busy man,
yes,
but for the heart you have for the work, you have to come because that's why it's good you deal with your own as a doctor, also a Christian. If you have brought a doctor who is a doctor but not a Christian, a lot of factors would have been involved. We really appreciate you, sir. Thank you for your time. Thank you for the enlightenment. I hope you were blessed today.